I'm going to describe something that I saw a couple of decades, maybe 3 decades ago. Um, I'm watching a commercial at home, at my parents' home, and I see the most bizarre thing. It's the dead of winter. This is why I can't show you the slides, by the way, copyright. It's the dead of winter. A woman walks outside. She is wearing shorts. She walks over to a piece of equipment and yanks the lid off of it and then walks back into the house, and you see it fire up, and you're like, I think that's her air conditioner. And she closes the back door of the screen, and then the next thing that comes up, and like, menopause consultations available at Shoppers Drug Mart. And at the time, it really made an impression. I was like, why would anybody turn on their air conditioning in the dead of winter? Can relate, okay? I now understand very fully. So this talk, I feel like is a little bit closer to home. So I would say that as a person, one of the words that might describe me would be resilient. I have been trained in a time when there were no work hour restrictions for doctors. So as a young physician, I had worked weeks that had alternating 132-hour weeks with 120-hour weeks. There are 168 hours in a week, in case you were wondering. Okay? I have had my thumb broken by a piece of surgical steel as a disciplinary action during a surgery and finished the case and did not cry. However, when my daughter was 2 weeks old, I did a presentation at a meeting not dissimilar to this. When she was 6 weeks old, I ran an international meeting. When my son was 1 week old, I took my son, who was 1 week old, on a plane with my daughter, who was 20 months old, so that I could present at a meeting. So prior to this, I would have said, what have you got? Bring it on. And 3 months into menopause, I was like, where are the drugs? Somebody give me some soon. So it is like a change of life. I think that is a fair way to describe it. Now, one of the things I'm sort of sorry I can't show you is that if you're a person like me, you have friends that are not dissimilar from you. So I shared in a friend chat, hey, I've calculated when all my cycles would be as I'm going into menopause, and they all immediately sent me the graphs of their own cycles too. So what you will see is that for those of you who have not yet transitioned, one of the things that people don't tell you is that there is perimenopause and then there is menopause. You don't keep having a regular cycle and then one day snap, you don't have them anymore. There is a period of time where you have cycles that become increasingly irregular, often very heavy, a lot of mood changes, a lot of hormonal changes, and just generally a lot of symptoms. And one of those symptoms is that it can be associated with very heavy bleeding. Now, if you take anything away from this today, if you are having very irregular, very heavy bleeding and you're around the time of menopause, you do want to share this with your medical providers and not just walk away from it, because one of the things, and I am an oncologist, that we do see are endometrial cancers in women in this age group. So if the bleeding is really heavy, you do want somebody to check it out, do some investigations, and make sure that there's nothing going on that you don't need to be concerned about. As you enter into menopause, there's a wide variety of symptoms that people often find debilitating. And similarly, this is also a really good time to have a conversation with your healthcare provider about whether or not you want to have any type of hormone replacement. Hormone replacement got a very bad rap, I would say maybe about 20 years ago, because prior to that, they gave it to everybody. And then they did a study that said it is terrible, and they took it away from everybody. And now I would say we've reached something called equipoise. And the reason that we did not know what was going on was because the science was not caught up to where the studies were. So the reason that the first group of women did really well when we looked at hormones was because they were very young. They did a nurses study, they were mostly in their 40s, and all of those women did brilliantly. They then did a study on women where the average age was 67, and what we learned is that if you give hormones to a 67-year-old, all those plaques that she has now developed in her vessels because she had no hormones will break off and cause her to have a heart attack or a stroke. So you have a narrow window of time to decide which way you're going with this. If you want to try hormones, you need to kind of do it around the time. Because if you get to a certain number of years past menopause, you then cannot go back and decide that you'd like to be on hormones. Now, it's not as simple as what I'm saying because there's so many issues that go into a personal decision. It's like, what's your personal history? And I will even tell you that when this happened to me, I have a lot of friends. I can phone a friend who is a gynecologist, and I was like, please just give me drugs. I cannot do this. And what you'll learn is you have friends and you think they're your friends, but if you you think they're your friends, but if you start asking them for like medical favors, they like to pretend that they are a doctor now. And they will make you, even me, go and have all of the investigations required to be getting these drugs, as opposed to just writing you a script in the hall as you might like, you know? So for everyone, there are individual factors and pieces of information that you need to have that will allow you to make a good decision for yourself about whether or not you'd like to have that type of hormone management. Now, some people feel that because there is a slight risk of getting a breast cancer, and there is, and it depends on your personal history, that they prefer to use a more natural course and not have hormone management. And what I would recommend in that case is that there's a wide variety of lifestyle choices that you can make that will reduce the symptoms that are associated with it. Most of those things are what caused me to want to live life. So in my case, so you have to exercise daily, you have to give up caffeine, you cannot have alcohol, and there is no chocolate. Exactly. Exactly. However, if you are the kind of person who can step up to all of that, there are other things you can do to help you. And we do have some non-hormonal medications that we give that also help. And these are actually antidepressants. They are being given for hot flashes and other symptoms. However, we do not know how this works. I don't know if it's just like you're happy now, so the hot flashes bother you less. But it does seem to help, is what I can tell you. So I say all of that to say it is an important transition. But there are some really good things that come along with it. And I think that has to do with the phase of life that you are in. I miss terribly not being able to bring my own babies with me to presentations like this because I'm now cringe and have aura debt, but that is okay. I am proud that my children are independent, and it allows me more time to be involved in other roles, to give some of the mentorship that has been given to me. I see Dr. Ismail is here, to people who are behind me in this sequence of events. So there are some very empowering things about becoming a woman who's reached a certain age. Okay, thank you very much.